So let's talk about what happens to those folks who have started last March with an awareness that their substance use doesn't have a great history, that it is a vulnerability for them. Either it's a vulnerability for them because they have a family history and they've kind of had a front row seat to what that looks like, or they recognize that they have overused in the past or used in places that have had negative consequences. So this is something that they want to either not do at all or to do in a very reduced, like a harm reduction, what we call model. Nora Volkov, again, who I mentioned a minute ago, I was just looking at this at the National Institute of Drug Addiction, cited a study that actually was done. It started in April and it was completed, I believe, in October, that noted there is a significant increase in lapse or relapse. Lapse being something where a person uses a substance but is able to stop. A relapse is when a person uses a substance and isn't able to stop for usually a series of days, if ever. That those circumstances are more likely to happen when a person does not have the types of specific social supports or motivations. Again, going back to what I was talking about regarding who you are, if you don't have things in your life that are telling you that you have worth and value, and to many of us, we are very conditioned to looking at external sources of validation to tell us, great job, you're worth this. When we're all in a place where we're either not able to do our jobs or we're not able to do our jobs the way we want to, or we're taking care of children while we're trying to work full time and thus not doing either of them the way that we would like to, a feeling of hopelessness can ensue. And because of the protracted nature of COVID, is it over, is it over, is it over? That has led to, again, that acute pain, which is often very much a trigger for continued use. So according to Volkov and others, there absolutely is an increased use. And critically, what they have found, and tragically, is that a person with a history of substance use disorder also has a greater likelihood of getting COVID. So one of the consequences, for example, of a person who vapes, a lot of people vape weed. And what we have found is that the stressors on the lungs, particularly for vaping weed, are significant. And what we have found statistically, according to Medscape and JAMA and Lancet and all of these other kind of publications, is that that increases your susceptibility to not only get COVID, but then to have significantly negative consequences. So that's a reason to pump the brakes. What we have found is that a number of organizations, Hazelden, Betty Ford, and others that we can know of, have been very quick, as is the Family Institute, to adapt to a telehealth model, which is great if you have the resources and the privacy to do it. The other thing that I would bring up is that people have been potentially going back to white knuckling it through this. And I would ask that people be particularly good to themselves as we transition. Because I believe that it's not a matter of like, whew, I made it through COVID and now I'm going to be fine. The transition's not going to feel great. And so what we find is that those things we used to do in order to help offset that kind of sense of isolation and loneliness aren't necessarily going to work quite as well. So as we are in it now, to again, take a beat. When you have that wine glass in your hand, ask yourself where you are. What is this doing for me? What needs is this meeting? And is there another way I could meet that need? And then continue to ask those questions as you go forward. But again, with an attitude of compassion and connection.